Hi, I am Giovanni Perez, and this is a PowerPoint on the occupation of a physician. This PowerPoint is a guideline for those who wish to become a doctor someday. With being a physician, one is given job duties, responsibilities, a process to follow prior to being hired, compensation, and short and long-term goals that must be set forth by the physician. Probably one of the most complicated occupations known to man, the life of a doctor is literally balanced between life and death. You become the one people seek for medical attention, and without a physician in their lives, mankind would not be as developed as it is today. This is the job of a hero, but this is not a job for everyone. The road for a hero is a very long and bumpy passage that can be too much to handle for some individuals. To start off, we're going to talk about job duties. With being a physician, there are many job duties that incorporate cooperation and individual effort. As a physician, you will work with primary health care teams to provide patients with medical care service. You must analyze test results, medical records, examinations, and reports to diagnose your patient properly. You must also need to be able to prescribe medication or other forms of treatment to your patient, and you must also know the side effects and the possible negative outcomes out of every treatment that you give. You must be aware of everything you put your patient through. So if you put them through a negative outcome, or if you give them the wrong medication, negative outcomes will soon follow. So you must know that. You must also follow all federal and state health information privacy laws. These privacy laws prevent information taken between a patient to doctor conversation out of the work environment, meaning that a patient's diagnosis is private and can only be known between the doctor and the patient. If this is talked about outside of the work area, then that's a very high chance of that physician losing their position. Also, finally, as a physician, you must be able to properly record all interactions with your patients, and it must be legible and timely to make accurate analysis of your patient's health. Also, with being a physician, there becomes job requirements. Now, the requirements for becoming a physician is probably the longest educated field that you have to go through out of all occupations there are to go through. First, you have to receive a bachelor, which is a 4-year degree in an undergraduate study. Though it is not given to you what undergraduate study you need to take, it is preferred to take either a bio or a pre-medicine study for your undergraduate years. After you complete your undergraduate years, you must pass the Medical College Admission Test, otherwise known as the MCATs. After you pass that, you have to apply for medical school. Usually, medical schools are tied in with a certain program, so applying to your medical school can be a lot easier and more broad. Just make sure you know that which one fits best for what you want to be. After applying for medical school, during and after medical school, you must take a 3-part exam. This exam is called the United States Medical Licensing Examination. You take the first 2 parts while in school, and then after you graduate medical school is when you'll take the 3rd and final part. After you graduate from medical school, you also start your 3-year residency program. The residency program is made for you to dial down and specialize in a field for a physician. Considering the physician is such a broad title, people that specialize either in the head or the heart or the back would be named differently and be specialized and trained for those 3 years more distinctly and what to do, like on-hands learning about that specialty. At the end of your residency program is when you finish your United States Medical Licensing Examination with the 3rd and final part. Once concluding your residency programs, you apply for the state license to practice medicine. And after you apply for your state license, then that is where you apply. Now, the hiring process for being a physician is also difficult. Considering the amount of jobs that are out there to be a physician, it is also hard to land a job near you. So becoming a physician could make you have to move state to state occasionally, considering how much it's needed elsewhere. It's hard to land an area local to you and the job that you want, because there can only be a limited number of physicians of your specialty in a given area. First, you give in your resume. So your resume should have a full-on skill list and list of achievements and whatnot. Everybody should know what a resume is. And that resume is going to help you best, because that is you on a piece of paper against your competition. There's always going to be competition. There's always going to be other physicians that want your position. So it's not guaranteed when you see an open spot. After you've given your resume, the corporation that you wish to work with choose whether or not to give you an interview. This interview is the turning point. This could sway in your favor or out of the favor of them wanting to hire you. It's best to wear proper attire like so, and to not hesitate like that. Don't do that. You need to be fluent with your words, proper, and breathe throughout the entire process, because you want these guys to think you're able to do this. The interview is what your best chance of becoming a physician. So that is what you're mainly looking for when it comes to a hiring process. Now, another thing great about physicians, all this hard work and everything, but compensation, so the revenue that comes in. With being a physician, you're paid a percentage of your billing or collection, or they base your performance and your value to the company through the resource-based relative value scale, otherwise known as the RBVS. The more you value to your company, the higher your revenue becomes typically, because of you're such an asset. It's hard for competition to work, though, considering the amount of physicians and how much they compete. So for the best competition, you want to compete positively. Not too much to create tension against you and your peers, but more to where you want to be the best at your job and receive the maximum amount of compensation that you want. Finally, the short and long-term goals of being a doctor. With short goals, there should be very simple-minded. You should treat your patients efficiently. You want to have a lot of positive relationship with your workers to make the environment flow a lot easier, considering how much tension is always in the hospital from all the sick patients and people that need help. And you want to achieve monthly goals and stay active consistently at your work and never try to lessen than you were before. Long-term goals, such as establishing annual goals, such as like a number of treated patients. Maybe you want to treat 1,000 patients this year, because last year you had 900 something like that. You also want to climb into the rankings, which means you want to be more comfortable and more suitable to the company and become more of an asset, as in getting a head physician position from given down after another person leaves, or you earn a new position that's created in the hospital already. The more of value that you become, it can also lead to you having a higher bonus. Bonus is given to you by the man that pays ahead, so much as your boss. If your boss feels like you are a value and you are very, very important to this company, then you may see a higher bonus because of how gracious he'll be for your efforts. Finally, going from an inexperienced physician to an experienced physician, just a few years of having that position will triple your annual salary. These are the short and long-term goals that you want being a physician. To end it all off, my name is Giovanni, and that is the occupation of being a physician.